Namaste. Welcome back to SLG Hello Doctor, your go-to YouTube channel for the views of experienced healthcare experts on topics of health and wellness. Cardiovascular disease is recorded as the leading cause of morbidity and mortality in India. Our genetic predisposition and acquisition of traditional risk factors at a fast pace due to rapid urbanization seems to be the major cause according to experts. Coronary Artery Bypass Graft, or CABG as we commonly know it, is the life-saving heart surgery that has been restoring health and hope of longevity since it was first performed over 60 years ago in the United States. Since then, the procedure has been redefined several times over, and today this precision-driven surgery has become fairly commonplace in most countries across the world and is increasingly successful in its outcomes. Today, we will be talking to Dr. G. Sudheer, Consultant Cardiothoracic and Vascular Surgeon at SLG Hospitals, Hyderabad, about CABG, what to expect, risks involved, and life after CABG. Dr. Sudheer, welcome back to SLG Hello Doctor. It's so good to resume our conversation on CABG from last time.
Thank you. Shall we start?
Yes, absolutely. Doctor, just to set the context, in a nutshell, can you tell us what is CABG?
CABG, Coronary Artery Bypass Surgery, is advised for a coronary artery disease patient who underwent coronary angiogram and diagnosed to have blocks in all the three or major left main coronary artery disease in his heart.
Doctor, this sounds like a big thing. So what is the risk involved in a CABG procedure?
Coronary artery bypass surgery is one of the major surgery that any patient undergoes in his lifetime. Coronary artery bypass surgery is the surgery performed on the heart. Heart is the major organ that supplies blood to every organ in the body, that is from brain to toe. So any organ can get damaged during this surgery, but the risk involved in this surgery is around 10 to 15%. It may include any of the organ injury or to the life death. That means if 100 patients are undergoing this surgery, around 10 to 15% patient might develop some amount of complications. It might include a neurological complication due to the injury to the brain, or a lung complications due to injury to the infections to the lungs, or it can be damage to the kidney or damage to the liver or any other organ of the body, or it may be a life risk sometimes. But the rest 90 to 95% patients do well after the surgery and without any complications, and they go home without any problem. In the same manner, people who already had a heart attack develop an MI will be having lesser ejection fraction than those people who are having only angina and angina on accession. Doing a bypass surgery on a patient with normal ejection fraction is less riskier than the patients undergoing CABG with low ejection fraction.
So doctor, you just mentioned about ejection fraction. Can you explain a little in detail what it is?
Ejection fraction is the amount of the blood that is pumped out from the heart for each contraction. It is calculated on the basis of echocardiogram. While doing echocardiogram, the cardiologist routinely looks into the ejection fraction and calculates the ejection fraction of the heart. For any normal patient, it lies between 60 to 65%, and those patients who already developed an MI and had some injury in their heart will be having lower ejection fraction than normal.
So doctor, should bypass surgery be done with patients having a low ejection fraction? Is it not risky like you just mentioned?
It is definitely risky to do a coronary artery bypass surgery in patients with low ejection fraction than in patients with normal ejection fraction. But in patients who requires surgery as indicated by the coronary angiogram, these patients should definitely undergo coronary artery bypass surgery with due risk. In some of these patients, the ejection fraction will improve to certain extent depending upon the amount of the hibernating tissue in the heart, that will benefit these patients and helps in improving his ejection fraction and helps him to lead a normal life.
Doctor, what's the duration for which the patient has to stay in hospital after a CABG procedure?
It is one of the most commonly asked questions by the patient attenders. The patients who are undergoing CABG needs to admit in the hospital 1 or 2 days prior to the planned elective surgery, and on the day of surgery he will be undergoing on the surgery, and after surgery he might be requiring 2 to 3 days of ICU stay, followed by 3 to 4 days of ward stay, following which he will be getting discharged. On an average, post-op the patient will be staying around 5 to 6 days in the hospital and 1 to 3 days prior to the surgery.
So doctor, once the bypass surgery is done, can the patient be assured that all blockages have been removed?
This is very important thing to know by all the patients who are undergoing the bypass surgery. The blockages are not at all removed in bypass surgery. We are only creating a bypass pathways for the alternating blood supply to the distal part of the blocks. That means if there is a block in the middle of the blood vessel, we are creating a connection from the place before the block to after the place of the block. It only helps in improving the blood circulation, but this surgery does not remove any blocks in the heart. It is also need to keep in mind that we will be bypassing the major blood vessels in the heart. Before the blood vessel supplying to the muscle of the heart, it divides into 14 minor branches, and all these branches cannot be bypassed. There might be small blocks in these minor branches, which is called as microcirculation, and these blocks remains further like that. This surgery will help only to avoid major adverse event of coronary artery disease.
What are the complications that can be expected out of a bypass surgery, and how should one be careful about dealing with those?
Bleeding, rhythm disturbances, decreased renal output, and low cardiac output state and peripheral shock. Delayed complications includes the infections, deep wound infections and superficial infections, and ventilator associated lung pneumonias, etc.
What medications are prescribed for the patient at the time of discharge?
The patients undergoing coronary artery bypass surgery at the time of discharge will be advised a group of medications. These include antiplatelet medications, which helps in making the blood thinner and avoids the formation of blood clots, statins, which reduces the cholesterol levels in the body, and also heart rate control and blood pressure control medications, and also painkillers and other supplements like vitamins and B complex.
For how long should the patient continue the antiplatelet therapy?
Patients undergoing bypass surgery will be prescribed dual antiplatelets. It means ecosprin and clopidogrel, two different types of antiplatelets. These are prescribed at the time of discharge. Usually the patient needs to continue these antiplatelets for at least 1 year, following which he can be converted to single antiplatelet, that is ecosprin 150 mg for lifelong.
For better recovery, what are the post-op dietary recommendations that the patients would be given?
Post-op, the patient needs to be very careful in maintaining his blood sugar levels, so he has to adhere to strict diabetic diet. Also, in order to have a good recovery, he should take good protein diet along with good multivitamins and antioxidant diet. These diets are prescribed by our dietitian at the time of discharge for all the patients.
It's time for a short break on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG Hospitals.
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స.
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స.
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ఐసీయూ బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు.
3 టెస్ట్ల ఎంఆర్ఐ, సిటీ స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500.
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor. Today we are in conversation with Dr. Sudheer G, Consultant Cardiothoracic and Vascular Surgeon at SLG Hospitals, Hyderabad, and we are talking about CABG. Post-operatively, how frequently does the patient need to come back to see the doctor at the hospital?
Once the patient got discharged from the hospital, we usually advise the patient to follow all the medications at home and review us to the OPD at the 10th day after the discharge for the suture removal, following by a routine checkup, which includes a routine checkup like ECG, echo and minor blood tests. After this, the patient is advised for the set of medications which he used to continue for almost 1 year. These he has to be on regular visit at least once in a month or to the least once in 2 months.
So doctor, when can a patient go back to his or her routine and normal activities? And how about the case of where the person is an athlete or a dancer or involved in some kind of a heavy activity or work?
Patients are trying to walk and do his routine normal activity before discharge from the hospital. After going home, patient need to maintain his wound care. He has to do his own wound care and also he can do his routine normal activities. At the end of 1 month, he can go back to his normal routine work if it is a simple work. But in persons who are to do heavy work, he has to wait for at least 3 months for complete recovery. And post-op, it is not advisable for lifting of weights more than 20 kg.
Doctor, if there is some other kind of complication and the patient needs to undergo a surgery, then how much gap should be there between CABG and the surgery that is now advised?
A patient who had already undergone CABG, if he has to undergo some other non-cardiac surgery, if it is an elective surgery, he can wait for at least 1 year after the CABG to undergo for elective non-cardiac procedure. If it is an emergency or semi-elective procedure, the patient can undergo at least after 3 months or any type of non-cardiac surgery with due risk, and he has to stop the antiplatelets prior to surgery at least 3 days before.
Doctor, we've been hearing that there's a lot of advancement in the CABG technology and the procedure itself. So can you tell us a little more about that?
Traditional coronary artery bypass surgery is done using the total sternotomy, that is cutting of the front bone from top to bottom. This is called traditional coronary artery bypass surgery. But recent advances includes mid-cab, that is minimally invasive CABG, and T-cab, totally endoscopic coronary artery bypass surgery, robotic cardiac surgery, etc. These are the recent advances which are available at present for performing coronary artery bypass surgery.
So doctor, what is minimal invasive heart bypass surgery?
Minimally invasive heart bypass surgery is done through the left anterior chest wall. Here the sternal bone is not open, the patient thorax is open. From the thorax we used to do the bypass surgery through the incision on the thorax. It will be usually around 6 to 8 centimeters incision over the left chest and small incisions for the tubes and other things. With this, if the surgery is done, this is called minimally invasive bypass surgery. Here the sternum is totally spared.
Doctor, you mentioned TCAB. Can you tell us a little more about that?
TCAB is totally endoscopic coronary artery bypass grafting. It is similar to our laparoscopic surgeries where we do through small ports in the abdomen. Here also TCAB is performed through small 3 to 5 millimeters incisions over the intercostal spaces over the chest. We will pass the ports inside, and using that we do bypass surgery. It is called as totally endoscopic coronary artery bypass surgery. It includes a camera which shows over the monitor, and we using the other ports we do the anastomosis for the coronary arteries.
So doctor, there's a lot of talk about robotic assisted surgeries. Do we have robotic surgeries in the cardiac realm also?
The advantages of these mid-cab or pre-cab or robotic surgeries includes like minimal incisions over the body and also cosmetic purpose and less pain and early recovery for the patient.
Doctor, finally, you've mentioned a number of alternative surgeries apart from the traditional surgeries. So what are the advantages of these surgeries?
The advantage of these recent advanced surgeries over the traditional sternotomy surgeries includes allowing sparing of the sternum, lesser incision, lesser pain, early recovery for the patient. With these surgeries, the patient can go back to their work as early as less than a week.
So grateful to you, Dr. Sudheer, for answering all our questions about CABG so elaborately and so patiently. You've cleared so many doubts that we had. And thank you so much for being here with us on SLG Hello Doctor.
Thank you. Also, I request all the viewers, if you have any doubts, you can share in the comments. All your doubts can be clarified. Thank you.
Viewers, we'll be back with you soon with yet another insightful health-related conversation. Until then, take care of yourselves and your dear ones. And yes, do not discard that mask just now. Viewers, hope you've hit the bell icon and are following all that's happening on SLG Hello Doctor. If not, do it right away.